The question is, do thyroid medications like Synthroid or levothyroxine treat the actual problem that's going on or just the symptoms of a problem? That's what we're going to cover in detail on Monday night, January 5th at 7 p.m. in the free class. So make sure you click the link, go to my link tree in the comments, wherever you can find the link to register. But I'm going to give you a little bit of information right now. The answer is no. They do not treat the actual underlying root causes in most cases, if not all cases, right? So they're treating the symptoms. Those medications, I'm not anti-medicine by any point. They do help a lot of people. But the second that you go off of those medications, all of these problems come back, right? Why is that? The answer is because we're not getting down to the roots. What's going on in the body that's feeding into that thyroid dysfunction? So there's a lot of things in other videos that I'm going to cover, but most of all, come to that talk on January 5th on Monday night at 7 p.m. because, I mean, your mind's going to just be blown. Light bulbs are going to start going off, especially if you have thyroid issues or if you're suspicious of that. So what I want to cover today in this little talk in the next couple minutes is just some of the negative consequences and side effects of thyroid medications, because again, we all know if you look at a medication, any medication, there's going to be side effects listed. They have to do that. Things that have been shown in the studies that, you could get this, and this. But what's often not talked about is something major that I find in so many people, no one's ever told them. And that is nutrient deficiencies. A lot of these medications pull or block certain nutrients and vitamins and minerals from being absorbed or utilized by your body. So if you think about that, that's a big deal because we need these vitamins and minerals to function optimally, like basically every system of your body, right? So again, I'm going to go into detail on this in the talk, but vitamin B12, if you know what that is, you know how crucial it is. Selenium, zinc, iron, vitamin D, magnesium, these are all impacted by the thyroid medications that you are probably taking or that you need to talk to your doctors about, or someone like me, whether you should start medications or not. So that's one aspect. Now, some of the side effects that actually are listed are usually going to say things like there's concerns and there's studies that have shown bone health issues. So things like osteoporosis, risk of fractures, bone loss, which is osteoporosis, osteopenia. These kind of things are common knowledge as far as these medications over chronic long-term use. Other things that have been shown in the research is cardiovascular issues. So whether that's increased heart rate, heart disease, those kind of things, increased blood pressure, those kind of things can happen on long-term use of these medications too. So it really kind of goes down to the fact of, is the risk-reward ratio there for you? So again, that's one thing with informed consent that you need to ask these questions and advocate for yourself. What's the risks? What are the rewards? And then the second question, even more important, is, Doc, have we gone over everything that could be going on underlying the surface causing these thyroid dysfunctions? Okay, now I'm just going to tell you now from a functional medicine perspective, right? This is where we dive deeper than quote unquote most traditional medical doctors. So is there gut issues? Is there hormone and endocrine system issues? Is there detoxification issues, lymphatic drainage issues, liver congestion and liver sluggishness? Like all of these things are so important. And I can tell you there's research done by a guy named Dr. Alessio Fasano at Harvard. He's the chief Harvard gastroenterology specialist. He literally says, quote, all disease starts in the gut. So even when it comes to thyroid dysfunction and thyroid, especially Hashimoto's, like autoimmune thyroid issues, leaky gut syndrome, gut dysbiosis, I mean, just ask yourself this question. If you have a diagnosed thyroid condition or you're suspicious of it, do you have gut issues? Maybe that's constipation, irregularity. If you're not pooping 2 to 3 times a day, you're constipated. If you're bloated a lot, if there's just upset stomachs, maybe you've been diagnosed with IBS, which is a terrible diagnosis. IBS basically means they don't know what's going on that's causing an irritable bowel, right? Irritable bowel syndrome is not a root cause diagnosis. There's something causing that gut to be irritable, right? And not treat you well. So again, that's a whole nother talk for another day, but are you just taking medications for that? Or are you getting to the root causes of these things? That's what we're going to do. We're going to dive into it Monday night, January 5th at 7 p.m. If this stimulates any questions, any thoughts, obviously DM me, but specifically sign up for the talk on January 5th. Pass this along to those who need to hear this information. All right, that's it for today. There's so much more I could cover, so much more I'm going to cover. So the main thing is get to that free talk on Monday, January 5th, 7 p.m. Start the new year off right, guys. I'll see you later. Bye.